Hi, this is Dr. Pelto. I want to talk a little bit about your surgery in the office. These are the tips that I give patients before, during, and after surgery. So let's get started here. The main questions that I get from surgery are, when's a good time? Depending on the type of surgery, if it can be an office procedure, any time is really a good time. If you're thinking of a larger surgery, such as a bunion surgery or to remove a bone spur, you really have to look at the good time in your work, when you can slow down, when you can take it easy, when you can take vacation. A lot of patients actually prefer to take surgery around a holiday time. For example, Thanksgiving and Christmas are all popular times because they can stay off their feet a lot more and allow themselves to get recovered. How long is my incision? Really based on the surgery and the location of it, your incision will be the length. We have to do the maximal amount of length, but also the minimal that's needed. How long will the surgery take? Depending on the surgery. If it's a bony type of a surgery like a bunion, it may take an hour, hour and a half. If it's just removing a soft tissue mass, it may only take a half hour, 45 minutes. How long will the recovery take? It really depends. If you're breaking a bone, you have to give yourself about 6 to 8 weeks to heal, such as a bunion surgery or a bone surgery. If you're doing a soft tissue surgery, mostly you just have to wait till the skin heals, and that may be 2 or 3 weeks. Swelling, though, may take up to 6 months to come down or even longer. How long will it be off of work? Really depends on your type of work. If you have a job where you can sit down most of the day, you may be able to go back within a couple of weeks. If you have a walking or a very manual job, you may have to be off 6 to 8 weeks. And then when can I start walking? For a lot of our foot surgeries, unless you're strictly told to stay off your foot, most people can walk after the surgery. They can walk around in a special walking boot or a walking shoe. Working out, that's always a big question for the ladies. Working out may be up to 6 to 8 weeks or less, depending on the type of surgery. And then will this come back? We really have to discuss more in terms of if this will come back for your particular condition. So let's go on and look as well some of the information about before, during, and after surgery. So before your surgery, you need to have a pre-visit with your doctor or the hospital. So a lot of times we use the hospital to do these pre-operative examinations, but you also need to make sure everything is safe with your overall health. You need to arrange a day ride the day of surgery and plan for time off of work. This is real important. You don't want to drive yourself to surgery. You want to make sure someone else can be there with you if needed. Nothing to eat or drink after midnight. It's very important for anesthesia especially. And then usually the hospital tends to call the afternoon before surgery to give you the time. And then you're going to be getting a cam boot and a shower cover for your surgical procedure. Most people need a cam boot, sometimes crutches, and then most people do well with a shower cover, at least for the first couple of weeks. During surgery, you're going to arrive about an hour before surgery. Children and diabetics usually are the first surgical cases of the day if we do multiple procedures. Arrive and change your clothes. You'll be given an IV with some antibiotics. That's for most surgeries, we give antibiotics. And then the doctor will arrive and do a lot of paperwork. There's 2 different types of anesthesia that are typically given. One is called monitored anesthesia care. That puts you into twilight, and we use something called propofol to kind of help you relax. And some of the patients need general anesthesia. That's where you're actually put under with a tube in your throat. We prefer to give monitored anesthesia as much as we can. If you're anxious, we're going to give you some medication for that as well. So after the surgery, so once the surgery is done, you can eat, rest, go home. You'll be getting a special shoe and probably some pain medicine. So these are what the special shoes and boots looks like, and the different types of devices. Maybe you'll need a wheelchair. This is a really versatile device. If you have a foot surgery, it's called Drive, or a kind of a rollabout. You put your knee on there and you can roll around and get around a lot easier without putting pressure on your foot. Post-operative dressing typically looks like this. This is a typical bunion dressing that kind of splints the toe over. And as well, here's an example of a posterior splint that's used on certain types of surgery. So some keys for after surgery. Make sure you rest, sleep, don't walk, elevate your foot, and ice. Okay. Take your pain medicines every 4 hours. And the key is to really stay ahead of the pain. That's the big challenge I have with patients, is that they'll let the pain get too bad and it's hard to play catch up. Some of the medicines I give for pain are Percocet and Vicodin. You take those every 4 to 6 hours. I'll give you usually Vistaril. That can help with any nausea that you may have. It's real important to take these 2 together. And then Motrin or naproxen every 6 hours for pain. The more you walk, the more pain you're going to have. So it's real important to stay off your foot, especially the first 3 days. That's when I find there's the worst pain. After surgery, I recommend using a shower cover to keep it dry. Don't drive with any pain medication, and then ice and elevate your foot. You can start using Mederma once you take the stitches out, and this is just something that helps with range of motion of the joint. So how do the postoperative visits look? Well, after surgery, you have the surgery day. About 3 to 5 days later, you see you back in the office for the first bandage change. The reason we do this is to look at the x-rays, make sure everything is okay, but as well evaluate if there's any signs of infection. That's very important, and that's when it usually shows up. After about 2 weeks, remove the stitches, and you'll begin any physical therapy, and then we'll see you every 2 weeks after. Just remember that the bones start to heal about 6 to 8 weeks in. Some important questions you really want to ask beforehand. If you smoke, it's recommended to stop prior because that's a big deterrent to having foot surgery. And if you're a diabetic, how is your A1C or blood sugar? If it's elevated, we want to get that under control before the surgery. And then do you have a history of any heart problems? That's something that's quite severe. And the main reason I do this presentation is to really evaluate any of the complications. This is something that we need to take time and talk about, but in most surgeries there's a risk of infection. If there is an infection, we give you an antibiotic, but it's something to not take lightly. Also, because you'll be sitting around with your foot up, a blood clot is very common in the back of your leg, or even a blood clot that can go to the lung. That's potentially a fatal condition. So you have to know that it's a complication that can happen. Slow healing, both of the bone or of the skin can happen, or wounds can happen. Scarring can happen. This is an example of a keloid, and this is an example of a clot. Both of these are potential problems. Nerve pain can happen, where there can be numbing or tingling or shooting pain to the foot or the toes or wherever the surgical location is. If we do a hammer toe surgery or a bunion surgery, there may be a problem with toe purchase, meaning the toe is not going to come completely down, and then loss of blood supply to the area. Those are all important things that may happen during surgical procedures. Typically after the first visit, we talk about how much activity you can do, if you need any more pain medicine, what type of exercises. This is a little video that shows how to move your bunion after surgery. And then on the second visit, that's usually where we remove the stitches, and you can evaluate once again how much activity, if you need any more pain medicine, and then how you can get back to normal activity. I hope you found this helpful. This should give you some more information about what to expect prior to your foot surgery.